Dear Joshua, we are first-year medicine students from the University of Groningen in the Netherlands.
First of all, we'd like to say that we find it very courageous of you that you're sharing your HIV experience to help others.
We have some questions for you about some of the things you talked about.
So you talked a lot about how once you were diagnosed, you decided to flip a switch and be positive.
However, we would like to know more about the negative feelings you might have experienced at the time. You said you received a lot of support from your family and friends, but we would like to know more about the negative emotions you might have experienced. Did you ever feel sad or ashamed? Were you afraid to be judged?
Did you ever get negatively judged, and how did you react to that? We think it's important for your audience to also know about the emotional difficulties of being HIV positive.
Also for you, we think it's very important that you stay in touch with your emotional side and that you seek help if you're ever experiencing mental difficulties.
About your medication, you dedicated an entire video to 2 different types of antiretrovirals and their side effects. I think it's very good that you are sharing this information because it must have an encouraging effect on people to go and get treatment themselves.
However, we would like to ask you whether having to take medication every day is a burden to you and how you feel about that.
We do want to encourage you to continue spreading the message that anyone can get HIV, and it's not only the stereotypes that society portrays that can contract the disease.
We also think it's very good that you, using your experiences, talk about the importance of using protection. Because just like in your case, even one time can make a difference.
However, we would like to know more about your opinion about having a serious partner as an HIV positive person. Would you ever stop using protection? How would you go about trying to have children?
In conclusion, we would like to thank you for your efforts and for sharing this information.
We would like to encourage you to keep on being active in this field because we know that you can make a difference.
For either newly diagnosed patients or anyone struggling with the disease.